This multivitamin and iron product is used to address or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body's overall health and well-being. Taking this medication can help ensure that you are getting the necessary nutrients to support your body's functions. It is important to take this medication as directed by your healthcare provider to get the maximum benefit. The recommended daily dosage and the optimal timing for taking this medication will vary depending on your individual needs and health conditions. Be sure to consult with your healthcare provider to determine the best time to take this medication for your specific situation. When taking Wellfola 20 mg Iron-1 670 Mcg Dfe tablet multivitamins, it's important to follow the directions provided by your doctor or on the product package. It's typically taken once daily, either on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take it with food, but avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication as they may decrease its effectiveness. If you're taking the delayed-release form or extended-release capsules, make sure to swallow them whole and not to crush or chew them, unless directed by your doctor or pharmacist. It's important to take this medication regularly at the same time each day in order to get the most benefit from it. Some common side effects of Wellfola 20 mg Iron-1 670 Mcg Dfe tablet multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body adjusts to the medication. If they persist or worsen, it's important to contact your doctor or pharmacist. Iron may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to keep Wellfola 20 mg Iron-1 670 Mcg Dfe tablet multivitamins out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's important to seek medical help right away or call a poison control center. Before starting to take Wellfola 20 mg Iron-1 670 Mcg Dfe tablet multivitamins, make sure to inform your doctor or pharmacist about any allergies you may have, especially to the inactive ingredients. If you have a medical history of iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems, it's important to discuss this with your healthcare provider before taking this medication. If the multivitamin also contains folic acid, it's important to inform your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia. Untreated vitamin B12 deficiency may result in serious nerve problems, so it's crucial to consult your doctor or pharmacist for details. Before undergoing any surgical procedure, it's essential to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication to ensure the safety of yourself and your baby. It's important to be aware of how Wellfola 20 mg Iron-1 670 Mcg Dfe tablet multivitamins may interact with other medications. This can affect how well your medications work and may increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of this product. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to be aware that this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If you or someone else has taken too much of this medication and are experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or reach out to your local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Wellfola 20 mg Iron-1, 670 Mcg Dfe tablet multivitamins, it's important not to share it with others. It's also important to keep all of your medical and lab appointments while taking this medication. Some brands may also contain ingredients such as docusate, so if you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. Remember, this product is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you are taking this product on a prescribed schedule and forget to take a dose, take it as soon as you remember. If it is close to the time of your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It is important to store Wellfola 20 mg Iron-1, 670 Mcg Dfe tablet multivitamins at room temperature away from light and moisture. It should not be stored in the bathroom and should be kept out of reach of children and pets. When it is expired or no longer needed, it should be properly discarded. It is important not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. It's best to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.